Hello everyone and welcome to my channel. So the newly approved drug that we are going to discuss today is Vericiguat. So we will be discussing our drug under the following points of discussion. Let us take one heading at a time. The drug that we are discussing is available in the brand name of Vericiguat. It is available as a tablet and the strengths are 2.5 mg, 5 mg and 10 mg respectively. The route of administration is oral. It was approved by US FDA in the year 2021 and it is a soluble guanylate cyclase stimulator. Before proceeding forward, let us have a discussion on endothelial nitric oxide. The endothelial nitric oxide is synthesized in the vasculature from the amino acid L-arginine, and the enzyme that is responsible for this synthesis is endothelial nitric oxide synthase. The enzyme nitric oxide synthase, it actually has three isoforms. One isoform we have studied just now, the endothelial nitric oxide synthase. Another one is INOS. I stands for inducible nitric oxide synthase. And the third one is NNOS. N stands for neuronal nitric oxide synthase. Now this endothelial nitric oxide, it can also be activated by acetylcholine, adenosine, bradykinin and by the shear stress on the endothelial walls. What is the role of this endothelial nitric oxide that has been synthesized? Now this endothelial nitric oxide that is been produced in the endothelium, it travels to the smooth muscle layer of the blood vessels. Now once it reaches the smooth muscle layer of the blood vessels, it binds to the heme group of the enzyme which is known as soluble guanylyl cyclase. Now this guanylyl cyclase, it is available as a heterodimer. This guanylyl cyclase, it has got a heme group attached. To this heme group, the nitric oxide comes and binds itself. Due to this binding of the nitric oxide, the soluble guanylyl cyclase, it is being activated. And once it is activated, it converts GTP or guanosine triphosphate to cyclic GMP. That's what we have written at. Catalyzes the conversion of guanosine triphosphate to cyclic GMP. So this cyclic GMP, now this acts as the second messenger. So due to this activation of the cyclic GMP, all the other downstream effects will be activated. So what are these downstream effects? Firstly, what happens in the smooth muscles? In the smooth muscles, once there is increase in the cyclic GMP, it causes an increase in the cyclic GMP dependent protein kinase G. So due to this increase in the protein kinase G, there is decrease in the intracellular calcium. Due to this decrease in the calcium, there is decreased phosphorylation of myosin. This decreased phosphorylation of myosin, it decreases the cross bridging between actin and myosin. And we know that the cross bridging in actin and myosin, it basically causes the muscle contraction. So if this cross bridging is not there, naturally the contraction is not there. So there will be relaxation of the smooth muscle. We have studied just now that there is smooth muscle relaxation due to the protein kinase G. Let us see how it happens. So let us suppose this is a smooth muscle. For this smooth muscle to contract, it must have calcium within the cytoplasm. Intracellular calcium must be there. Now we know that the calcium is stored in the sarcoplasmic reticulum. So this sarcoplasmic reticulum forms as a reservoir from where calcium will be released, and this calcium will ultimately help in the smooth muscle contraction. Now this release of calcium from the sarcoplasmic reticulum is occurring with the help of this ionocetal triphosphate. And once there is activation of the cyclic GMP dependent protein kinase G, this release with the help of ionocetal triphosphate, it is being inhibited. So now the sarcoplasmic reticulum is not able to release the calcium into the cytoplasm. Second thing what is happening is that there is the presence of the voltage gated calcium channels. So from these voltage gated calcium channels, calcium is going to come from the extracellular to the intracellular, and the level of calcium within the cytoplasm will be rising, and ultimately there will be muscle contraction. So due to phosphorylation of this channel, voltage gated calcium channel, this channel is also being deactivated. So due to the deactivation or inhibition of this channel, now this inflow of calcium is also not possible. And the third thing is that it is basically phosphorylating and activating a compound known as phospholamban. So what is phospholamban doing? Phospholamban is basically helping in the reuptake of the calcium from the cytoplasm to the sarcoplasmic reticulum. So if there is activation of phospholamban, then again there will be decrease in the level of free calcium which is available for muscle contraction. So in a nutshell, the cytosolic calcium that was supposed to help in the muscle contraction, that is being reduced. Also there is phosphorylation and opening of the calcium activated potassium channel. Due to this activation of the potassium channel, we know there will be hyperpolarization, and because of the hyperpolarization, the L-type calcium channels will also be reduced, will be rather closed, and due to the closing, there will be reduction of the flux of calcium into the cell. So far what has happened? The sarcoplasmic reticulum, from where the calcium was supposed to come out into the cytoplasm with the help of IP3, ionocetal triphosphate, even that is getting blocked. The voltage gated calcium channels through which the calcium was supposed to enter, even that is getting blocked. Phospholamban, which helped in the reuptake of the cytosolic calcium back into the sarcoplasmic reticulum, is getting activated. And also there is closing of the L-type calcium channels due to hyperpolarization. So again the calcium is not able to enter. So the level of calcium within the cytoplasm is going to decrease. And if the level of calcium is going to decrease, then instead of contraction, what we are going to get is basically relaxation. Now again in cardiac tissue, what it is doing? In cardiac tissue, it is causing ventricular relaxation. Now if there is improvement in the ventricular relaxation, it means that there is improvement in the diastole. And we also know that the coronary perfusion basically occurs during diastole only. So there will be improved coronary perfusion. Now what are the other actions? The other actions are, it is going to inhibit the platelet aggregation. Hence the chances of thrombus formation will be reduced. It is going to inhibit fibrosis and inhibition of smooth muscle proliferation. Hence the chances of remodeling will also be reduced. What is the mechanism of action of Vericiguat? So far what we have studied, you have got an enzyme, the soluble guanylyl cyclase. This soluble guanylyl cyclase, it has got a heme portion. To this heme portion, the nitric oxide is coming and it is activating this soluble guanylyl cyclase enzyme. Now why soluble? Because this is an intracytoplasmic enzyme. The entire enzyme is present within the cytoplasm only. So once this enzyme is being activated by the nitric oxide, it is converting the GTP into cyclic GMP and we are getting all the downstream effects such as smooth muscle relaxation, improvement in the diastole and coronary perfusion, decrease in the platelet aggregation. Now, in a patient with heart failure, there is disruption of this nitric oxide soluble guanylyl cyclase cyclic GMP pathway. That is, this pathway is getting disrupted. Why? Because the level of nitric oxide in case of heart failure is low. Hence the SGC enzyme is not getting activated because of the low nitric oxide. Here comes the action of Vericiguat. What this Vericiguat is doing is that it is activating the guanylyl cyclase or the SGC enzyme independent of the nitric oxide. That is, it is a direct stimulator of this enzyme. So once this enzyme is getting stimulated directly, all these effects are going to occur. And hence the patient of heart failure is actually going to improve. So what is the dosage? The starting dose of this drug is 2.5 mg orally once daily with food. The dose is to be doubled approximately every 2 weeks. The target maintenance dose is 10 mg once daily. Now if the patient has difficulty in swallowing, this tablet may be crushed and mixed with water. So this drug is to be given in case of symptomatic chronic heart failure patients whose ejection fraction is less than 45%. And what is the advantage of this drug? It causes a reduction in the risk of cardiovascular death as well as heart failure hospitalization, especially in patients who have been hospitalized or they need an outpatient IV diuretic. The contraindications. This drug is contraindicated in case of pregnancy. Now if the patient is using any other soluble guanylyl cyclase simulators such as Vericiguat, then in that case also the two drugs are not given simultaneously. Now, breastfeeding during the treatment with the drug is not recommended. The most common adverse reactions are hypotension and anemia. Concomitant use of phosphodiesterase 5 inhibitors and Vericiguat is not recommended. Now, what are phosphodiesterase 5 inhibitors? One of the example of the phosphodiesterase 5 inhibitor is sildenafil. It is given in case of erectile dysfunction and also in case of pulmonary artery hypertension. Now, the enzyme phosphodiesterase 5, it basically causes the degradation of cyclic GMP to 5' GMP. So now if the phosphodiesterase 5 is being inhibited, then the level of cyclic GMP will be high. Now if the same patient is being given Vericiguat also at the same time, then we know that due to Vericiguat, ultimately GTP will be converted into cyclic GMP. So if both of these drugs are given together, that is phosphodiesterase 5 inhibitors and Vericiguat, the level of cyclic GMP will be very high. We also know that cyclic GMP causes the relaxation of the smooth muscles. Hence it is going to cause blood vessel relaxation. If there is relaxation of the blood vessels, then there will be hypotension. If the cyclic GMP level is very high, then there will be an increased blood vessel relaxation, and hence there will be a severe reduction in the BP, and the patient is going to have dangerous hypotension. So that is why we do not recommend the use of these drugs together. The pharmacokinetic parameters of Vericiguat are: it accumulates in the plasma with the level reaching up to 155 to 171%, and it reaches a steady state after approximately 6 days. The bioavailability of Vericiguat is 93% when taken with food. The volume of distribution is approximately 44 liters, and it is 98% bound to plasma protein, primarily serum albumin. Now students, we have got a detailed discussion on bioavailability as well as volume of distribution. The link to both of these lectures will be given in the description box. Please feel free to check it out. The half-life of the drug is 30 hours. It is primarily metabolized in the liver by the process of glucuronidation and excreted from the kidney as well as from the feces. From the kidney as an inactive metabolite, and from the feces primarily as an unchanged drug. So to summarize everything, the drug that we have studied today is Vericiguat. It is a soluble guanylate cyclase stimulator, and it is indicated in case of symptomatic chronic heart failure whose ejection fraction is less than 45%. So that's it for today, guys. If you like this video, then please give it a thumbs up, share this video, and do let us know in the comment section what other topics you would like us to discuss. Also subscribe to my channel and press the bell icon so that you don't miss out on any upcoming videos. Until next time.